Good evening, everyone. Wynn Brown here with our Friday, the 15th of May COVID-19 update for Haywood Healthcare. I hope everybody had a good day. Beautiful out there, although we are expecting some inclement weather to run through our region, including a tornado watch. So everybody keep a weather eye out and pay attention to that and make sure everybody stays safe, okay? Let's look at our testing. To date, we have tested 3,743 individuals and have received 3,150 negative results back, 429 positive results, 44 indeterminate for a positive rate of 11.8%. State rate is 19.4%. If you look at Worcester County, we are up to 8,555 cases, and Franklin County sits at 302, which I feel was the same number as yesterday. At Haywood, we've seen an uptick in inpatient volume, so that just is a call to action to everybody that we need to be vigilant and doing all the right things out there. We have 6 positive inpatients right now, one of whom is in our ICU, and we have 8 patients under investigation. So those are numbers we haven't seen for almost 2 weeks now. So we've had a little uptick, so let's pay attention. We're also providing a graph with this video of our local hospitals that they're keeping track of their statistics. So that is Leominster and its Clinton campus and Marlborough Hospital, so you can get a sense of the disease load in their region. In particular, Marlborough Hospital, probably because of its larger population and its proximity to, between Worcester and Boston, you can see that they have much larger numbers overall. So please take a look at that. Just a reminder too that Dr. Ashley Warner, one of our primary care physicians who's based out of our West River Health Center, is accepting new patients. And we're also planning on moving her into downtown Orange later this year into a new facility and be part of the downtown there. And so if you are interested in transitioning to her practice, you can call 978-544-3865, gives everybody in the western part of our service region another great primary care physician to choose from for your care. So please consider Dr. Warner if you're thinking about changing primary care physicians. Also, want to announce that Haywood Healthcare's Food for Families initiative had another successful week. We've been doing a lot of work around food security and with our help from the team at ACT Fasteners. And so I just want to let you know that this week we restocked 2 food pantries with a total of 18,000 pounds of food, 2,550 boxes of cereal, 3,060 cans of pasta sauce, 1,600 pounds of pasta. And again, we're supporting over 650 local families with food bags to make sure that they have the nutrition that they need in their household during this challenging economic time during this pandemic. So thank you to everybody, and Teresa Thompson, who leads the effort of and the manpower to make all of that work. I got some thank yous today. First to Peter McDonald of Sunrise Senior Center in Leominster, who is a longtime supporter and advocate for our health system. He delivered ice cream novelty treats to the staff and patients of GPU. Thank you very much for that, and I appreciate Peter and all the great work that his team does in the Leominster region. Chair City Church provided their final meals to all 3 shifts in the Haywood ER, so thank you very much for that. And also Chris Calley and the family at CrossFit 696, who have always been strong supporters of the health system, sent over a thoughtful note, a treat basket, and food gift cards, and we delivered that to Watkins One, and we'll use those gift cards to treat staff along the way as well. And then we have a photo of embedded with this. And Winnie Rivard, I think I've said her name probably 15 times during this pandemic. She is our intrepid sewer and supporter of us. She delivered more isolation gowns this week, making nearly 70 she has sewn, and we thank her very much for doing the great work that she's doing. If you remember the hummingbird video that was earlier this week in there about what one person or one individual can do, she is one of those people that has found her niche and is contributing to us into this pandemic, so thank you. And then Bonnie Grant of Winchendon delivered 20 hand-sewn isolation gowns as well, so thank you very much. So we've got the community sewers are still out there strong, and we appreciate it. I looked out my window today, and my window faces toward Crystal Lake and over the loading dock, and there was a big Army truck out back, and I thought, what is going on? The Army delivered 7,500 gowns of various design, isolation gowns, disaster gowns, and so we appreciate the Army dropping that off, and that was really fantastic. So our supply of PPE is solid, but again, we have no idea how strong the future deliveries will be, because everybody, as you know, is vying for the PPE. So thank you very much to the Army for doing that. A reminder to all staff on the Haywood Hospital campus, we have a major power shutdown tomorrow as we swap out a major industrial size breaker that we had to have built specially for us. And so that means in particular that the kitchen will not have power, and so we're going to be serving continental breakfast and salads and sandwiches at lunch, and thank you for that. That's coming from the Gardner Ale House supporting us, and all the patrons of Gardner Ale House who have supported the gift card there. So a shout out to Gardner Ale House and the community. And just because I know this video goes well beyond the walls of Haywood Hospital, Don Casavan and I talked, and we thought it just might be good for everybody just to know what we are offering right now as you consider to return to get your care inside our health systems, which we are on a journey to be one of the best in the country. We have Haywood Hospital, Athol Hospital, the Quabbin Retreat, Haywood Medical Group with practices throughout our region. We have Haywood Rehab as well on 3 of our campuses, and so we have pretty robust outpatient and inpatient services, and we have incredible physicians. In addition to primary care, we have our gastroenterologists, OBGYN, bariatric surgery, general surgery, endocrinology, infectious disease, oncology, and hematology. And so I think you should feel very confident in the providers that we have. I should add rheumatology as well. And just feel comfortable working with your primary care physician and accessing those services with us throughout this pandemic. We've done everything to make sure that it's safe, and we are beginning our return to surgery, as I've talked about before, and endoscopy services, beginning with urgent cases, and then as we are allowed to, we will ramp that up even more. So feel free to seek out care. Both our ERs were busy this morning, and again, we're seeing high acuity come to us because people have waited a long time to get their care. So don't hesitate to get your care. With that, have a great weekend. Keep a weather eye out there for some of the storms that are supposed to blow through this evening, and I'll be back to you tomorrow. We'll talk about how the day went, how our power change out went, and our big breaker move at Haywood, and talk about everything else that's going on. So thank you for all you do in supporting us as we continue our journey to be one of the best community-owned health systems in America. Have a great evening, everyone.